Hey, everybody, and welcome back. So we are still going through our video series for our website, just trying to break it down and share each little section with everybody in bite-sized pieces. We did the overall one, but now we're going into each section, and I'm going through each individual block really to try to show you what we have available in all of these different areas. So we are going to be in the treatment section today. So when I click on treatment, so again, website is hcbmhas.org. And here is our treatment section. So here we're going to go over again, there's different types of treatment when we talk about somebody who is struggling with mental health and substance use. And so there's outpatient, which involves receiving mental health or substance use related care within the community context. And so those are going to be our main contracted treatment providers that we will talk about. And so this may include medication, counseling, maybe groups, depending on what that person's needs are and that level of care that they need. We also have inpatient, so that means being admitted to a hospital, admitted into an inpatient facility where you will stay long-term depending on what your needs are. And again, that level of care that you need. Now, medication-assisted treatment, this is the use of medications in combination with treatment. So in combination with counseling or therapy and other recovery support groups, typically used for opioid addiction or substance use. Residential, this is sometimes what we call rehab, people who check themselves into rehab where they can live, and it's a facility providing therapy and counseling and services for mental health and substance use for a specific allotted time. And then withdrawal management, or again, what's typically called detox, which is done under the care of a medical and mental health professional. And so this is where patients are monitored, they are checked, and they are kept safe, making sure that they safely withdraw from whatever substances are in their body, and then linking them with supports after detox is very important. So detox is one step. But then we also want to link residents and individuals with the needed resources for aftercare, taking care of themselves after the substances are safely out of the body, the patient is stable, then we can move the client into whatever level of care they are needing, whether that is going to be rehab, whether that's going to be inpatient treatment somewhere, or back out into the community connected with, again, outpatient treatment. So one of our local counseling agencies. So when we look at outpatient treatment, we are going to have, here's going to be our main three contracted providers. Now, what this means, what I say when, or what I mean when I say contracted providers. So the board contracts with specific agencies within the community to provide specific services. So the board utilizes the funds that it's given. So again, going back to our original video of who the board is, when we did an overview of the website, who the board is, we do not provide direct services. So our job is to just monitor, assess, evaluate, prioritize, and plan for the services available in Huron County, making sure that services are available for residents when they need help. So that's what we do. And so then we utilize state, federal, and local funds to then provide those resources through the agencies that we have available. We contract with three main providers. So Family Life Counseling, Firelands Counseling, and Oriana House. And so what that means is that through our contract, residents can access services at any of these facilities. And when they do access services there, they what's available to them is a sliding fee scale. So through our contract, we are able to provide a sliding fee scale to residents in Huron County that help residents who maybe have issues with their insurance, or maybe they don't have insurance, maybe they have a significantly high copay, and the board can step in and work with our providers to ensure that residents still get the care that they need, regardless of insurance or financial concerns. I will also say with these contracted providers, through some additional funding made available through the Healing Community Study, we were able to secure vehicles for all of our contracted providers. And so for residents who have difficulties with transportation, our providers can go and pick up residents for their appointments and make sure that they get to their needed services. And so all of our providers offer both mental health and substance use services. And so that's going to be one-on-one counseling. It can be group therapy. It's also medication assisted treatment is also involved there as well. And so if you click on any of these links, this is going to take you to their website, their information. So we have family life counseling and psychiatric services. They have 2 locations. They are going to be located in Norwalk and in Willard. Firelands Counseling and Recovery Services. So they are located in Norwalk and in Bellevue. And then Rigel Recovery. So this is when I said Oriana House. Oriana House is kind of like the parent organization. Rigel Recovery Services is the program and services available to the community. So this is located in Norwalk, and they do adults only. Firelands and Family Life Counseling, they do adults and youth. So this is our treatment section. It's pretty quick, pretty easy. We have 3 main treatment providers. We do have on the resources, or no, is it the about page or the resources page? I forget. But anyway, we'll get to that in one video. I know we will. There will be a link to other resources in Huron County for mental health or substance use services. We just do not contract with them, which means, again, they don't have access to our sliding fee scale, but that we also don't have that additional oversight for those providers. And so there's really some additional benefits when you do have a provider who is contracted with the board. But again, it's great to have options, and we want the community to know what their options are. So we make that information available, although we cannot vouch for any agency other than these 3 on this page. So again, if you have any questions on any of the treatment resources, any of the providers, feel free to contact the board. You can reach out to us through our website, a contact option. You can always call us at 419-681-6268, or you can reach us on Facebook, however you would like to. And we're here to answer any questions that you may have and help you find the resources that you need to get the help that you're seeking.